Hi everyone, how are you? All right, so today's topic that we are going to discuss is, do you gain weight right after surgery? I know a lot of you guys are stuck on the scale, and you look a lot at the numbers on your scale to determine your results, and you're going to be surprised. Probably some of you guys, I think, are going to be surprised by if you gain weight after surgery, immediately after surgery. We're not talking like, weeks and months of feeding the fat. So we're talking about immediately after surgery. Do you gain weight? If yes, if no, why not? What you can do to help get that weight on or off, because I mean everybody have different body types. Some of us, we it's easy for us to gain weight. Some of you guys, it's hard for you to gain weight, and you're trying to have that skinny BBL, and you have a high metabolic rate naturally, and it's hard for you to gain weight. So today's topic, we are going to talk about, do you gain weight immediately after surgery? So of course, I know you guys, as always, let me see your results, surgery bay. You've had 3 rounds of major surgery. I am now roughly around 4 months post-op. I've lost track. I had surgery the 23rd, I think, of May. So let me show you all. Let me show you all the boobs first. I am so in love with my boobs. The size of the boobs. And I don't know if I'm a B or a C cup. I think I'm probably a C cup or a small C. I really need to go and get myself sized for new bras to see where I am right now. So this is what your girl looks like. So this is what I look like at almost 4 months post-op. So let's get started with the live. Let me just sit here and adjust my little selfie stick. All right. So I have my little notes that I made here. So me personally, give me one quick second, guys. Sorry. Oh, sorry, that was an important message I had to respond to there. All right, so let me go back to my notes here. So I'm gonna tell you guys what happened to me personally right after surgery. This round, I actually weighed myself because I have a scale at the recovery house. So when I went to get my massages from my masseuse, I weighed myself to see what weight I had. I knew what I went into for round 3 and what weight I was after. When I had my first 2 rounds, that really was never a priority for me, or it wasn't important for me, because for me at least, I want to know how my clothes fit. That's how I kind of gauge, my results, if I'm liking or not liking it. I'm not big, I've never been big on the scale, because I feel like what we consider healthy, or how we feel about our bodies, and what the American Medical Society deem as healthy. Like, for example, for me, my BMI right now is like 29, and I like how I look. But according to the American Medical Society, my BMI should be at 25. I feel like if I go down another maybe 30 pounds or whatever, my ass going to be looking anorexic or sick, or like something wrong with me, right? So I like my weight, I like my BMI. So your personal preference in regards to if you are all into the scale, or if you are all into your inches and things like that, depends on you. So I went into round 3. I was about 173 pounds. And when I weighed myself after surgery, so this is probably like maybe day 2 or day 3 post-op, which is, I have a good amount of fluid in me now from coming out of surgery. I was 186. So all of that fluid that accumulated, and people were answering the question and saying that it's the tumescent fluid. I don't even know if the person that said that is aware what they're saying, or if they're aware of what is tumescent fluid, but it's not that. It's naturally your body's function. You know, after you go through major trauma like that, the body is going to increase in fluid, in plasma, you know, depending on how much water you drink and things like that will determine, you know, will help you, with how your body is healing. You know, so the fluid accumulation is a natural body's response to you undergoing major trauma to your body. So I was 186, and I would say for me this round, I started seeing that number going down maybe within probably the first 10 days to 2 weeks. So what I did to get that fluid to start going down, and my advice to you guys, it's a combination, guy, of things. It's not, let me drink a whole bunch of pineapple juice because bromelain is going to help with my inflammation and help get my fluid down and things like that. No, it is not just one magic whatever. It's a combination of different things you do. So I'm going to talk about what also causes not just the trauma, but what also causes the fluid to increase in your body, and what you can do after to get that fluid to go down. And then, depending on the length of the video, I'll scroll up and see what questions you guys may have put in the comments, and I'll answer it. But you guys that have been following me for a while now know that when I'm doing a video, I like to discuss what it is that I'm doing the video about, and not be sidetracked and answer your questions until after. Or we can do just a Q&A and you guys can ask questions and I would answer it on the live, right? So, not just the body's natural response to the trauma and you filling up with fluid. And I also feel like the bigger we are BMI-wise, based on my experience with my own body and other customers that I've had and seen, the bigger you are, the more fluid you have in your body. The skinnier girls, the slimmer you are, they don't have as much fluid post-op, you know, for the masseuse to take out to them. So, sodium. You guys that are lovers of Gatorade right after surgery because you think that you need to be hydrated and your body needs to have those salts, the sodium replenished, that is not true, guys. So you want to be very careful with hydrating yourself with Gatorade, Powerade, any kind of electrolyte that has sodium in it, because that sodium will increase the fluid amount in your body. So what should you be drinking? Water. A lot of you guys are like, I hate water, I don't like the taste of water. Well, unfortunately, suck it up. You're gonna have to drink water. Not water with all these added flavor drip bottle thingies that you buy in the supermarket to give the flavor to it. Just remember, guys, that a lot of these packaged things that you guys like to consume, the key ingredient, and this is why people get hooked on junk food, the two key ingredients that they add to these things is sodium and sugar. And it's hidden, you know, whether it's high fructose corn syrup, or, you know, salt, sodium is in there, and this is what makes these things taste so good to us, and we're hooked on them and we want to eat it all the time. So avoid that sodium, whether it's the Gatorade, salty food, salty snacks, chips, nuts, you know, different things like that. Being overly active. So I think some people take it overboard. Yes, your doctor wants you to get up after surgery, move, you know, don't be in that bed 24/7, moaning, groaning, feeling bad for yourself. But you also cannot be overly active. Like I had one girl that I know from Facebook, from those group chats from back in 2017, and she did one round with, let me even call his name. Anywho, she was telling me that after her surgery, and she had, I don't want to lie, I know she had a tummy tuck before, but yeah, she did, I think she did mommy makeover with him. So she did tummy tuck, lipo, BBL, and breast with him, breast lift and reduction. And she was telling me that she would leave the recovery house and go walking in the neighborhood, and she would walk like every day for like 2 hours and come back to the house. Guys, that is ridiculous. And guess what she told me after, when she told me, when she was talking about, oh, I was so active after surgery and da 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 da. Like, she didn't know, because she was saying it in a very proud way. She was draining fluid from her abdomen for like 3 months. And why her body keep producing so much fluid for her to be draining with a needle after a tummy tuck for 3 months is because she was so active. Another thing that you guys may not know, when you're overly active, when you're doing too much after surgery, that increases your risk of getting an infection. So, true story, one of my customers had surgery 8 months ago, went right back to work. She had a breast reduction, lipo-BBL, and her PCP in America, 8 months later, post-op, she had this issue, and her PCP is explaining to her what happened. She came down here for some treatment, for the doctor to take care of her, and he also agreed that she was doing too damn much too soon right after surgery. So what is doing too much too soon after surgery? And it depends on if you have an arm lift, a tummy tuck, just lipo 360. In her case, it was just lipo 360. So she got fat necrosis in her butt cheek. And that fat necrosis now, what happened internally in the body is the fat turned to like an oil liquid, and it got trapped in a cyst, in a pocket. So there's now a pocket of oil inside her butt, and she's not aware of this. And 8 months later, it decided to show up. And how did it show up? So first it showed, she started seeing a big indentation on her butt cheek. Then the area got a lump. Then it started being a little like sore and painful. When she went to her doctor in America, of course, everybody in the hospital and at the doctor is telling her, well, we don't know what to do with this. We don't know how to treat it. You have to go back to your surgeon. So she had to come back here to DR, and I believe she's going to come back again in another week or so. I need to message her to see for another follow-up to make sure that everything is okay. When she came down here, what they had to do, besides doing, sonography and a scan and stuff about the body, the doctor had to drain that area with a needle, send that fluid for like a biopsy then, or to be tested. That took I think about maybe four days or more for her to get the results back, to make sure that she does not have an infection. And based on those results, if she did have an infection, will then determine what type of antibiotics the doctor would have to prescribe to her. She had to go see an internal doctor for a follow-up also before she left. One thing, you guys who like to save money and bring all your medicine from America and bring it down here to the DR that you're not aware of is that you just cannot take any antibiotics and have your doctor in America prescribe you any antibiotics and bring it down here to the DR, because it's a very, oh Lord, I'm still making so much noise. I hope you guys can hear me. Some neighbors doing some work outside. So your doctor, based on each individual person, your own germs that you have in your body, will then tell you which antibiotics to take. So it's not a matter of just buying any kind of generic antibiotics and bringing it down here to take. Because what if that antibiotic does not treat the type of whatever situation you may have going on inside your body? So not everything you can buy and bring with you here to the DR medicine-wise to save $1. And just to let you guys know, the medicine down here that you're prescribed, and if you guys can't hear me because they're so loud, let me know. I'm going to go inside. But the medicine is not expensive. The most expensive thing when you get your prescription from your doctor is the Clexane, the anticoagulant blood thinner shot. That is the most expensive thing. Antibiotics, the enantium that they may give you, or Oxafort for pain, which is really not a strong painkiller, guys. That's cheap. Like seriously, it's cheap. When you buy your medicine from the pharmacy, like for our recovery house, the pharmacy gives us a 10% discount on whatever you buy from them. So I mean, that helps to some degree. If your bill is like $200, $250, you're getting $25 off, right? So if you want to bring Clexane shots, then okay, bring that. But antibiotics, the other little antibiotic cream and Hibby Cleanse and all those things that the doctor prescribed to you is not that expensive, guys. So back to drinking water. You guys knew I did a video before about why it's so important to drink water. Listen, the more water you drink, the more it helps flush that fluid out of your body. It probably doesn't make sense to some of you guys because you're thinking, I'm full of fluid, why am I drinking water to add more water weight? It's not necessarily water weight that you have from the trauma, right? But drinking more water, increasing your water intake, helps the kidneys, help the body, help your lymphatic system especially, not just flush toxins, but flush that fluid that you have in you out, so you'll be peeing a lot more. So some people, for example, like to take the water pill. So the water pill with you drinking a lot of water, because obviously if you're drinking the water pill, you need to increase your water intake, increase your potassium intake, which is like eating bananas. That's going to help also to get that fluid out of you. I remember I told you guys just now in the video, it's not just one thing you're going to do after surgery and you're going to get this fluid to come out of you quicker. It's a combination of stuff. So drinking the water pill, increasing your water intake, cutting out the sodium or limiting the sodium that you drink, Gatorade, Powerade, salty snacks, nuts, chips, all these different things that you guys may want to, have an appetite for, junk food after surgery. It's a combination. Another thing that I love, that I swear by, that I did for my own last round, and I feel it's a combination of two things that really help with my inflammation. Because sometimes you're swollen and it's not necessarily just only water in there or fluid in there. It's inflammation. So sometimes you look swollen, sorry. Your masseuse is massaging you and trying to push and see what fluid they can get out, but no fluid is coming out. And that's because it's not fluid in there at this point, it's inflammation and you're swollen. So what I drank, I made a combination of ginger, turmeric, and pineapple as a tea. So I don't care for the tea bags. I mean, yes, it's a substitute, but if you can get your hands on fresh ginger, raw turmeric, and the pineapple, boil all of it together in a pot of water. That's it. Just add the pineapple. You don't even have to peel it. You can add the skin, everything, because you're going to be straining it before you drink it. I actually blended mine. I blended mine in the Ninja and then added the water and put it to simmer. Turn it off. Once it came to a rolling boil, turn it off and just let it sit on the stove for a couple hours. Strain it. You can put it in your refrigerator. You can add green tea to it, like green tea bags if you want, and drink it, and of course sweeten it with sugar or honey or agave, whatever you like, and then drink it as a cold iced tea. You don't have to drink it necessarily hot. I mean, I like tea. Caribbean people like tea. Trinidadians like tea. So I was drinking it, hot as a tea. You can add your milk, whatever you want to it. You can even add cinnamon to it because, cinnamon helps regulate like your blood glucose. A side effect of when you have surgery. Yes, Juliana, I will put it on YouTube for you. A side effect of after you having surgery is your blood glucose spikes a lot. So before I became diabetic and I had my surgery, I was normally like a fasting glucose of like 103, which is 100 and less is you're not diabetic, right? When I had my surgery, my tummy tuck, my glucose for how many days was like 225, 200 and something, So you can add cinnamon to this. So turmeric, ginger, pineapple, add some cinnamon, sweeten it. Like I said, make it into an iced tea with green tea, put it in the refrigerator, or drink it hot. Add your sugar, your milk, whatever you would like to it. Massages. Guys, you cannot come down here. That's my loud neighbor. You cannot come down here and have a tummy tuck or lipo and go back home full of fluid and have no massages, no masseuse, no backup plan, no post-op care. You are seriously asking for your ass to not just get an infection, but be hospitalized or be dead. Because what if you get sick and you have an infection, and a blood infection, sepsis, and you just think you're feeling sick or whatever, and you stay home and you die. nosy ass little neighbor I have. I don't like this little boy. I ain't even gonna lie to you. But I'm gonna leave that topic for a whole nother day. Over here watching my damn life. Anywho, let's go back to what we were talking about. So, massages. I have had people that have come down here for surgery. I had this one customer. She had a tummy tuck. She is a weight loss surgery patient, and her surgeon decided that and I'm talking about the customer was at my recovery house. The surgeon that she went to, he told her that, ma'am, you are too big for me to put you on your belly and do a BBL and lipo. So I am only going to do a tummy tuck on you, and I'm going to do a little lipo on the sides by your ribs, your flanks. Now, I understand that when you guys come down here alone by yourself, you're lonely, you don't have company with you, you're afraid, you're scared, you're anxious, you're nervous, you're feeling all kind of ways, you don't have anybody to give you that emotional support, so you're homesick. You miss your family, your man, your girlfriend, your children, your whatever. However, you decided that you wanted the surgery. You decided that you wanted to change your life, change your body, whatever, and that comes with the responsibility of not just laying on somebody's table and letting them cut you open, but what are you going to do after to take care of yourself? Because the majority of these doctors do not give you good post-op advice, if they give you any at all. The doctor assistants, who you probably will be seeing after surgery and not the doctor for your follow-up, these people a lot of times are not even medical students or have any kind of medical knowledge or training. They are secretaries, they are receptionists, they are assistants. They are not they have nothing with the medical field, and they don't know what to tell you, and they don't know what is proper post-op advice to tell you to do for yourself. So this young lady, and like I told you all, the bigger you are, however you want to interpret this, as me being rude, blunt, direct, whatever, if you're fat, you need to get some goddamn massages. Because the bigger you are, the more fluid you're going to have in your damn body. And I'm talking about my own personal experience with a BMI of 36 and BMI of 33. Okay? So she had this tummy tuck, a little bit of lipo on the flanks and the side, did not have a BBL or back lipo, because like I told you all, the size of her, the doctor told her, I don't want to put you on your belly because I'm worried that doing that could give you problems with breathing. That's why. Like, maybe it could possibly make her heart stop by trying to flip her over. You know, and like I said, all that weight laying on her chest. So she did not get massages. She stayed. She decided she made all kind of excuses in the world about why she was gonna go home early. I think she said a family member died, and that's why she was gonna go home early. Well, I may sound mean, cruel, evil, lack of compassion, or however you all want to, you know, you all love to say shit about me, so whatever you all want to say. But ma'am, you are about to die. Your family member already died. What are you going to do? You are like, at this point, she was like 2 or 3 days post-op. You're going to leave the Dominican Republic and fly how many hours to go back home, wherever, right? Increasing your chances of DVT, deep vein thrombosis on the plane, a blood clot going to your lungs, or going to your heart, or going to your brain. You don't want to get massages. You are complaining about you're in so much pain, When I asked the masseuse, you know, how is her massages going, the first massage she got, she did not let the masseuse touch her body. She asked the masseuse to massage her legs. The second massage, she had them do the body massage. The third massage, I think she refused it. and then she decided to go home. She went home. I never heard from her again. She never messaged me to tell me how she was doing, whatever. I pray to God that she's alive and she's healthy and she's well. When I ask her who will be doing your massages when you go home, whatever, do you have a post-op plan? What are you going to be doing? She she told me that I was being what was the word? Because I want to be accurate when I say this to you guys. I'm trying to remember what word she told me. Something about not that I was being unfair or something like that to her. And I was like, hold on. Me being concerned about your health, about you living or dying, about you having a successful surgery journey without post-op complications is me being like unfair to you. She didn't say unfair, it was another word. And then I said to her, say no more. I will not ask you anything. I will not give you any advice. I will not inquire about how you're doing, whatever. And she went home. So I say all of that to tell you all, that little story to tell you all, you better have a plan. Because after surgery, like I was saying earlier in the video, when you are doing too much, it is a ripple effect of all what could happen to you. Like when I had this last round of surgery, Dr. Rami told me, no driving for 3 weeks. Don't go to the recovery house for 3 weeks. I want you to stay home for 3 weeks and do nothing. Like, don't do anything, because the more you do, you can increase your chances of getting an infection. Not just things like ripping open a stitch, damaging internally how your results is going to look, whatever. And guess what? I'm not going to lie to you all. I have a business to run. I had to get up and go to my recovery house and do what I had to do. And I actually had some very inconsiderate, entitled ass Caribbean people at my house. And I was over there cooking for one of them, answering her WhatsApp literally when I opened my eyes in the recovery room, in the overnight room, because she's concerned about her Fahad shrunk. When you've been following me for years and you don't know your stage 1 Fahad don't shrink, because that fabric does not shrink. It's spandex. It's not a stage 2 power net material Fahad. Anywho, I was doing a lot. And I pray and thank God that I did not get an infection. Yes, I took my antibiotics, I took my blood thinner shots, whatever. I wasn't driving. I had my driver drive me around. But I was at the house taking care of my customers, taking care of business. And I thank God I did not get an infection. But that is what happens. And I just told you guys a story about my other customer, 8 months post-op. 8 months post-op, and what happened to her with her going back to work and doing too much. And she only had lipo 360, BBL, and breast lift and reduction. She did not have a tummy tuck. So imagine having a tummy tuck, having all of that fluid in you, and you doing a lot. And then what happened to you? So my advice to you guys, and I'm going to summarize this whole thing we were talking about, your weight increasing after surgery, what makes your weight increase and what to do to get it down. I will just summarize at the end of this video before I put it on YouTube what I spoke about earlier, which is, yes, your weight increases right after surgery. It doesn't matter what kind of surgery you had. And that is fluid internally in the body, which is the body's natural response to major trauma. The person that answered and said it's tumescent fluid, that is not true. Tumescent fluid is when you get lipo, traditional lipo, it's called tumescent lipo. And the term tumescent is when they inject into your body, before they lipo you, a saline solution. And that saline solution, with other medications in there, which I'm not going to get into right now, helps the fat to break up so they can lipo it out easier. So tumescent fluid is why your weight increases after surgery is not an answer. That is wrong. Sorry. It's the body's natural trauma by your body creating a lot of fluid internally. So how do you get rid of that fluid? A combination of things, which is limit your sodium intake, Gatorade, Powerade, salty snacks, junk food. Do not be overly active. Yes, your doctor wants you to get up and walk for 5 minutes, 10 minutes, and take your ass back to bed. We do not want you walking an hour up and down the people's streets, walking an hour up and down the house, jumping in place, whatever. No, we just need you to get up and walk around maybe every 2 hours for 10 minutes. or 5 minutes, because especially with that muscle repair, with the tummy tuck, you guys are going to be out of breath, right? So walk around in your bedroom, walk around in the living room, or go up and down the stairs, twice and go back into your bed. So do not be overly active. Drink a lot of water. My patients who have drank a gallon of water a day, they are the ones that have healed and bounced back from a tummy tuck, which to me is the most aggressive surgery. Lipo is like, to me, nothing. It's painful, but it's nothing compared to how horrible you feel after a tummy tuck. They are the ones that bounce back really quick and healed really quick. The tea I was talking about, whether you want to drink it hot or cold, the basis of the tea, and you want to drink this 2 to 3 times a day, guys, is ginger, raw turmeric, pineapple, skin on, peel on, everything on. You could do green tea if you want to add green tea, or black tea, whichever one your preference is, and add some cinnamon. That's going to help regulate your blood glucose after surgery, with spikes after surgery. Massages. Get your massages. If you're here in the DR for 2 weeks, 3 weeks, 1 month, even better if you can get 15, 20 massages before you leave and go home. When you go home, guys, you want to keep getting your massages, if it's 2-3 times a week, for at least the first month post-op when you go home. And then the days that you're not paying for a massage, you need to massage yourself. It's very simple, it's very easy. Google it, YouTube it, look at your masseuse, what they're doing, and when you go home, mimic it yourself. Get some coconut oil, $5 a bottle in Walmart in the bacon section. It's nice and slippery, lubricated. You have no excuses. The water pill. This is also what helps. It's going to make you pee a lot. Don't take it before you go to bed. Take it in the day. Here in the DR, it's over the counter. It's called Lasix, 40 milligrams. You want to take 1 in the morning, maybe 1 in the afternoon, but not before you go to sleep. It will have you peeing every 5-10 minutes. You don't want to pee down your faja, right? So you can get it over the counter, but of course, talk to your doctor about it. You want to increase your water intake and your banana intake, because you need to increase your potassium when you're taking the Lasix and the water pill. And compression, meaning a proper stage 2 garment, not the stage 1. I don't know these cheap people that be wanting to keep their free stage 1 from their surgeon and don't have $150 to buy a stage 2 garment. If you heal, we're not even talking about getting infections, seroma, hematoma, all of that from wearing the improper garment. But we're just talking about if you heal and you look jacked up and your body look bad, don't complain. Get at least 2 stage 2 fajas so that you have one when you have your period. You have a clean one every day. I don't know about people wearing the same faja for days and days and days without taking it off and washing it. Guys, that's disgusting. And that is how you be catching a damn infection. Especially, let's say that you have a splitting stitch. And if you don't know splitting stitches, meaning that your incisions, your belly button, your breast, your tummy tuck, this can open up to a year post-op. Splitting stitches can happen up to a year post-op. What is the splitting stitch? That is when the suture thread that they stitch you up with, some of it remained internally, did not dissolve, and then it starts pushing itself above the skin. Then you have a little hole, a little raw spot, and depending on how you take care of it, if you don't know what to do, it can get bigger and bigger and bigger, and now you have an ugly scar, or you have a big ass hole and you're wondering what the hell to do to take it. You may have to go get it stitched depending on how severe it gets. So all of these, guys, it's a snowball effect. It's a snowball effect. You need to get into your stage 2 faja, not just to shape your body, but that nice super tight compression to get that fluid out. If you leave that fluid in there, what can happen? Infections. Then you all want to blame the doctor. Cellulitis, you all want to blame the doctor. It's not the doctor, it's you not doing what you're supposed to do. The incision with the fluid accumulating now because you didn't get that out, the incision can bust open. Right? You can get MRSA. I kid you not. I kid you not, these dirty fajas that you all be wanting to wear, and that fluid that may be leaking out and it's on there, and you're not washing your faja, and you're not making sure and cleaning and dressing your incision sites properly, you can get MRSA, end up with a wound vac. And who you're blaming? The doctor. Sometimes you guys have to take responsibility for your own actions and not blame the doctor. And in 2022, with all these damn smartphones and Siri and Bixby and whoever the hell else, you all have zero excuse not to know how to find information on the fucking internet. And I kid you not. All this damn petty gossiping, drama, whatever, commenting on all kind of shit on social media. Use that damn 1 hour that you're arguing with people in the comments and go and look up how the fuck to detect post-op complications after a tummy tuck or lipo 360 or whatever, and how to treat it if you have something happen to you. Alright guys, so that is the end of do you gain weight after surgery? Somebody was here in the comments talking about, let me see what you look like surgery, babe. Let me end the video so y'all can see what I look like. Let me pull my pants down because I was sitting. So these are the boobs, guys. No implants, just lift and reduction. Belly. Let me pull this back so you can see the waist from the side. Guys, I have an amazing ass video that's going to be coming. I can't wait to post it. But I think, YouTube, Instagram is shadow blocking me because I'll be posting stuff and like y'all ain't seeing it, y'all ain't commenting, y'all ain't liking it. The views, whatever, is like low compared to how high it used to be before. So my recommendation is, if you want to see what the heck I'll be posting, is turn on post notifications or go scroll my feed. Alright guys, so let me end this video. I might come back and do the one about the tummy tuck we were talking about in the IG stories today. If not, I will leave it for another day and give you guys chance to comment your questions or your answers, I'm sorry, on my IG stories today, and then we can do the video about the tummy tuck, how to recognize complications and how to fix it and whatever, maybe in another day or two or next week or whatever. Tazia, yes, thank you. I love them. I love them. I'm not gonna lie, I love them. And my little natural cleavage here, like Rami did good. He definitely gave me what I asked. So I was like, doctor, make them chiquito, like make them small and no under boob sweat. They're sitting up. I do not have good skin elasticity. That's why I didn't get implants, because he told me the weight of them would make the breast sag quicker. And he told me to join the damn gym and start going to the gym, but I don't like the gym. Alright guys, so I'm gonna end this video and I will talk to you all a little later.